Nada Acupuncture help with addiction and trauma. Addiction and trauma are two very heavy and complex things to grapple with. Fortunately, no one has to battle either or both alone. Along with treatment solutions that take a person's individual needs into account, there are supplemental therapies that can help promote healing and recovery. The National Acupuncture Detoxification Association, or NADA, acupuncture protocol is one of these therapies. What is the NADA protocol and how can it help in addiction, trauma, and other mental health conditions? Licensed acupuncturist Tim Soba explains how it works and shares some tips for ensuring success with this form of acupuncture. The NADA protocol was created in the 1970s at Lincoln Detox in the Bronx, New York. This form of acupuncture for the withdrawal of drugs was rooted in the research of Chinese neurosurgeon H.L. Wen. Wen took a closer look at the effects of electrostimulation on the ear's lung point and how it could help in relieving acute opium withdrawal symptoms. Today, NADA provides training for addiction and harm reduction counselors, mental health therapists and social workers, correctional officers and drug court personnel, disaster relief teams and trauma support center staff, first responders, health promoters, nurses, and EMTs, acupuncturists, and medical doctors. Ear acupuncture points for the NADA protocol. While traditional acupuncture sessions might involve the placement of needles in different points of the body, the NADA protocol is an auricular or ear therapy. Needles are placed in 5 specific points, and patients rest for about 30 to 45 minutes with them in. The points are kidney. This point promotes healing in the organs and can help ease the symptoms. Liver. The liver ear point helps with blood purification and detoxification. It's also believed to reduce anger and increase confidence. Lung. The lung ear point can help with the release of emotions and expand lung capacity. Shen Men, also known as the divine point or heavenly spirit gate. The Shen Men point is believed to have a calming effect on the mind and body. It can also promote detoxification, reduce pain, and help energize other acupuncture points. Sympathetic. This point helps manage the sympathetic, which regulates the fight or flight responses, and the parasympathetic, which maintains rest and digestion, branches of the autonomic nervous system. It's good for pain relief as well because it dilates the blood vessels. NADA is usually offered in group settings, which makes it more affordable. But there's another added value in this community acupuncture approach. People experiencing it will know that they're not going through things alone. The advantage of the group setting is its combination of shared experiences, accessibility, and affordability. From a purely clinical standpoint, you get the shared effect of being around other people, which gives the perspective that we're all going through this together. What can NADA acupuncture help treat? The NADA protocol has been shown to decrease cravings for alcohol, drugs, and even cigarettes. Soba says it makes withdrawal symptoms less intense as well. This form of acupuncture can also be used to help manage gambling problems and food addiction. NADA acupuncture has been instrumental in helping people recover from trauma or natural disasters. When used after 9/11, it helped people relax and sleep better. The same could be said when it was utilized after Hurricanes Katrina and Rita in 2005. There's a group called Acupuncturists Without Borders, which goes to places to use this protocol to help those affected to decrease the stress of these situations. Additional benefits of the Nada acupuncture. One study showed that the Nada protocol could help improve the quality of life for those who were in traditional treatment programs. Participants who received Nada acupuncture reported feeling better about themselves and had more energy. They also engaged in less alcohol or tobacco use during the 3 and 6 month follow-up periods of study. The Nada protocol can increase calmness, promote better sleep, and decrease agitation and stress. Overall, it just leaves people feeling better, and that allows for more positive things to happen. For example, using it in a mental health situation could help people calm down so they can form better connections with their therapists. This then leads to better counseling sessions moving forward. What are the risks of the Nada protocol? As long as you're going to a trained acupuncturist, there are no risks. Side effects are essentially non-existent with the Nada protocol or acupuncture in general. The needles are all single-use, sterile, and disposable, so there's not much of a risk for infection. And when properly done, the needles don't go that deep into the ear. Does acupuncture help with addiction recovery? According to Sobo, Nada acupuncture is more effective when participants are receptive and committed to treatment. If the willingness isn't there, the protocol won't be successful. For it to work, there has to be a desire to quit. For example, you can't be passive about wanting to quit smoking. If you have the mindset, I'm going to quit smoking and I'm going to try my best to do everything right, the Nada protocol will be effective in addition to that. It's important to realize that the overall process is going to take time, but Soba says that you should notice results in a few sessions. It won't be a situation where you're treated 7 times and nothing has changed. For example, if you're trying to quit smoking, you may notice that instead of smoking a pack a day, you're only smoking 3/4 of a pack by 2 or 3 visits. As you keep getting treated, that 3/4 of a pack can go to half, then 1/4, and eventually you'll have less of an urge to smoke. Getting there might take a month or a few months, depending on the person's history of smoking. But since we're using the Nada protocol to help treat addiction, the withdrawal symptoms have been brought down gradually and managed. The same goes for trauma and mental health conditions. It's going to be a process that builds on itself. Single one-off traumas can be treated quickly and efficiently with the hopes that they won't become lifelong problems. But if you have a long history of trauma, the length of your treatment will depend on your goals and the conditions that needs to be treated. It's as similar as seeing any mental health professional. You might never really be totally done with them, but you can eventually get to the point where you just occasionally will need their support.